Agatha Lynn. I practice in Charleston, South Carolina. I bought an existing practice straight out of dental school, so I was kind of out there on my own right away. And I bought a practice with a lot of older patients. I was seeing a lot of things fail. I was seeing a lot of things that looked good but weren't holding up, and I didn't really have answers for why. And of course, patients wanted answers. And I needed answers for myself. I needed some way to figure out what was going on, and I was just getting really frustrated with myself because I felt like I just graduated from dental school. I should know more. I should know how to tell them things, and I was just patching things and hoping for the best and trying to find some answers as fast as I could to help, to help everyone. Luckily, I was still in Charleston, which is where I went to dental school, so I had good contacts through the dental school, and it's a really great prosthodontist there, and I was telling him my frustration and what was happening. I just felt like I wasn't helping anyone, and he said, go to Dawson. So I took that first course, and I feel like everybody has their story of the first time they met Pete Dawson, and I went up and I talked to him at the first break we had, the first day of lecture, and I was absolutely terrified at him because I was looking around the room and I felt like a child there, like everyone was an experienced dentist and they knew what was going on. And I just asked him what to do with patients who I knew they needed major treatment, but I had to do something in the meantime. And I was trying to ask him, if I have to do this crown, how do I do this crown so I don't make it worse, but I'm still helping the patient? And he said to me, if you explain to the patient what's going on, and you can portray what's going to happen and how it's going to get worse, why wouldn't they want that treatment? And I was frustrated because I was looking for kind of a quick fix, I guess, an immediate, like, how are we just going to get by? And I was trying to find a way not to go the full route. And I was terrified to talk. I was terrified to talk to him after that because I felt like I was such a bad dentist. Like, why, I've got to find something that I can do tomorrow. And I think by telling me that, even though at the time it was frustrating and I didn't know where to go with it, it got me to go forward with the classes. It got me to talk to my patients, to make them understand that yes, I can put that crown on there, but that's not going to solve everything else. We have to look at this, and it made me go the full route with everything to learn how to do this properly, and not just let's patch the problem and hope it goes away and hope for the best. So even though I guess it kind of frustrated me at the time that he said that, it's what got me this far. I'm not the type of dentist who likes to hop around and see a ton of patients. That's just not my personality. I like to spend time with my patients. I like to do that, and it's letting me do that more and more. I'm not just doing a lot of restorative all day long and running around trying to make a decent living. I've got bigger cases going on, and I'm slowing down and I'm spending time with those patients. And I'm probably seeing fewer patients, but it's not hurting my practice. We're actually doing better than ever, and I'm feeling confident with the treatment, and I'm getting more comfortable doing the treatment, talking to the patients about treatment. And it's been a really stressful time in my practice because there's so many changes going on, and I'm a very structured person. I like things in the regular pattern, but it's really changed the way our practice is, and it's been in such a good way. I told my husband I felt like an ostrich with my head in the sand, and somebody dug me out and I popped my head out and I was terrified. I saw it everywhere. All my patients had this, and I knew that we had to start doing something because it was everywhere. So it was kind of an aha moment of, this is why this is happening. I see what's going on, but I was also scared because in the meantime I had to go back the next day and prep that tooth that was already on the schedule, and wait a minute, I'm not dealing with the rest of it. So it was a really scary time for me, but in a good way. I was starting to get answers and I was seeing what was going on. And yeah, right from the beginning, just reading through the textbook before I even went to class, I was starting to put it together. And it was a good feeling, but it was just really scary at the same time because all of a sudden, everything scares you. You're almost afraid to start touching teeth again. I kept talking to so many dentists who had come because of their failures, and I guess I was just afraid to fail. I wanted to make sure that I started doing it right instead of just fixing everyone that I'd already, caused more problems for. So, there was a lot going on. There's tons going on in the practice, but it was helping me in more ways than it was causing me stress from being away from the practice. I started Dawson, I was a little over 2 years out of dental school, and I was so frustrated in only 2 years that I was actually looking at changing careers. So I'm excited about dentistry again. I'm gone all weekend, and I come home late Saturday night and I have only a Sunday with my husband before I go back to work, but I'm more revitalized after doing that than being at home all weekend. It makes me really excited about a career in dentistry, whereas before all I could think about was what my next career move was. How was I going to pay off my dental school debt so I can move on to the next thing? Because I started out really unhappy with dentistry. I went to college with a lot of people who were becoming physicians, and I was drilling holes and filling them. And I thought a monkey could do this. Like, what am I doing? I don't have answers for these patients. I'm drilling holes and I'm sticking stuff in it. And it made me feel like I was at their level. I became a physician, you know, a physician of the mouth. I understood what was happening. I knew why it was happening. And just personally, it's made me a lot happier and a lot more fulfilled. I feel like I help people now. I don't just drill a hole and put some stuff in it.